In podcast episode number 60, I talked to Canadian researcher Yannick Toussignon-Laflamme about the Pain and Disability Drivers Model, abbreviated as PDDM Model. Yannick is a professor at the School of Rehabilitation at the University of Sherbrooke, and his research activities target the management of chronic pain associated with musculoskeletal disorders and particularly low back pain. We started out by talking about the goal of the PDDM model, which is to help clinicians identify the drivers of pain and disability that go beyond the usual biomechanical drivers of pain. It was proposed to integrate a true biopsychosocial approach for low back pain. In practice, the model provides a diagnostic structure for clinicians to integrate biological, psychological, and occupational components into their assessment process. In the beginning of the podcast, Yannick explained all of the elements of the model, which I will quickly summarize. So the model integrates all aspects of the ICF form into 5 different dimensions. The first 2 dimensions are nociceptive pain drivers and nervous system dysfunction drivers. The focus here is on body functions and structures to figure out the drivers of pain, but they do include some prognostic factors as well. For every dimension, you can see an inner circle marked as A and an outer circle marked as B. A refers to more common and or modifiable elements, while B refers to elements that are more complex and less modifiable and that will prompt a more aggressive approach or require interdisciplinary care to effectively address the problematic domain. For these 2 domains, the PDDM model integrates classification systems like McKenzie or Salmon's movement system impairment syndromes. Domain number 3 are comorbidities besides low back pain. Those can be MSK pathologies, but also mental health disorders or sleep disturbances. One thing that Yannick mentioned about comorbidities stuck with me. He said, if you want to sensitize somebody's nervous system, let the pain be there and do nothing about it. It's like leaving the fire on. Domain number 4 and 5, so cognitive emotional drivers and contextual drivers, are psychosocial components that are drivers of pain and disability, but mostly disability. These contextual drivers are further split into social and occupational, or in other words, work-related factors. Next, we also talked about the importance of communication with other healthcare professionals. While the model is very complete and assesses different domains, you might have to get in touch with other healthcare professionals in order to perfectly target all domains of your patient's problem. The only thing we agreed on that is missing in the model is lifestyle factors. The reason being is that Yannick and his team try to include targets that can be changed in a relatively short time frame. An important aspect of the PDDM model is the use of questionnaires. The reasoning behind it is what gets assessed also gets improved. During their research project, Yannick and his team would also ask patients to fill in a series of online questionnaires about 20 minutes before their appointment, and the researchers would then get a dashboard with automatically analyzed results indicating which domains need further questioning. Those patient-related outcome measures are then also used to assess a patient's improvement over time. I really like the analogy with the dashboard of a car where different sensors and lights tell you your speed, state of the engine, battery, and so on. If you lose your dashboard, you can probably still drive your car, but you're putting yourself at a higher risk of unwanted events. If you are curious about the questionnaires that are used in the model, check out the link in the video description where you can download the PDDM model rating scale. We then talked about the term nonspecific low back pain and whether it is helpful or not. Yannick explained that the term is not really helpful because it does not really tell me anything as a physio except that nothing major is going on in a patient's back. It doesn't tell us anything about prognostic factors. To help with that, the model tries to identify drivers of pain and disability in patients with back pain. In turn, explaining those drivers to our patients can reassure patients suffering from non-specific low back pain and to help them make sense of the situation. Towards the end of the podcast, we discussed if we as physiotherapists are well equipped to target all 5 domains when it comes to treatment. We agreed that probably most physios are good when it comes to the first 2 domains, but that targeting the 3 other categories is still something that is underutilized in practice. At last, we talked about the future of the model and Yannick's further research projects. After the PDDM model got validated for low back pain, they are now busy developing an online assessment tool to make it available to clinicians all over the world. Furthermore, they are trying to adapt it for neck pain as well. All right, so this was a brief summary of podcast episode 60 with Yannick Toussignon-Laflamme. I hope I could raise your curiosity to listen to the whole episode and to learn more about the PDDM model. If you would like to have more resources, download our Physiotutors app and get access to the transcript and infographic. As always, thanks a lot for watching, and I'll see you in another video. Bye.